95.3 FM, WNN.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hello, South Florida and beyond, and welcome to You and Your Doctor, the Tuesday night edition here on the radio. And as you know, we're Facebook Live on All County Healthcare's Facebook page, as well as the All County Healthcare website. That's allcountyhealthcare.com. If you have any questions about Medicare or home health or the Medicare certified agency, you can call Maddie at 888-717-7170 or go to allcountyhealthcare.com. And I'll give out that info again. They're nice enough to sponsor this great show where we take you on an adventure through the ins and outs of healthcare. And one of those ins and outs that I'm going to get to for a second, but before I forget, I always got to go to All County Healthcare's Facebook page and go ahead and share it to my friends and followers, because like I said, we're on Facebook Live, and I just think that's awesome. So that's the first thing I do. But one of the paths in healthcare that the hospital groups are taking is help with behavioral health, as well as depression and psychotic disorders. And I'm really happy to have on the program, the first half of the program is going to be Miguel Fernandez. He's a licensed clinical social worker and certified drug and alcohol counselor. And I believe a former director of nursing, but I'll ask that in a second. And then the second half of the program, we have a great family practice physician on the program. And I hope I don't mess up his name, but he's a great, I just met him in the green room. He's awesome. He's board certified family medicine, Mohammed, Allahrakha. So we'll have to ask him if I got that right. I may have got it right. I see you.
I think so.
Shaking your head, Miguel. So I think now. So now I'm going to share. Boom. It's that easy, people. You can see us on Facebook Live right now, All County Healthcare. But before I rant and rave on anymore, I want to welcome Miguel Fernandez to the program. Miguel, how are you tonight? Thank you for coming aboard.
Very well, thank you. I appreciate the opportunity to come to your show and speak about the things that we're doing over at Florida Medical Center.
Yeah, and it's great things because I've known that hospital for about 5 years. I used to drive by it on the turnpike and always wonder what the Florida Heart Institute and that neat state of Florida with the heart. I was always wondering, man, that must be an amazing heart hospital, and it is. But just in the last 5 years, the transformation that's gone on there. Yes. I know you have a new great CEO, Trey Abshir, and he actually wants to come on this program, so I'm really excited. So we'll have to do really well tonight so he sees this. But even in the realm of behavioral health, you guys have an unbelievable program. You said you've been there about 14 months, but
that's correct,
which is a little while now. But tell me a little bit about that behavioral health. I didn't introduce you properly before. You're Miguel Fernandez. You're LCSW CADC, but you're the Director of Behavioral Health Services at Florida Medical Center. So tell us a little bit about it,
That's
the program.
Correct. I am the director of the behavioral health program. Our behavioral health service line includes licensing for 74 psychiatric beds. Currently, we have operating at the facility adult psychiatry, which is generally for patients that are ages 18 all the way up to age 60. As well as a geriatric psychiatry unit where we generally will have patients anywhere between 55 and older who have illnesses that are more related to that you will see in the geriatric population, sometimes with schizophrenia and other psychiatric disorders, as well as sometimes other things like dementia and other altered mental statuses. And so that's what services we're providing. In addition to that, we recently began the expansion of our service line into offering electroconvulsive therapy. We'll speak a little bit more detail, I believe, further down the road, but we're excited to be able to bring that service line to Florida Medical Center.
Wow, that just sounds groundbreaking, like technology there, electrotherapy.
Electroconvulsive therapy.
Okay, I better write that down.
Otherwise known as ECT.
Okay, really neat.
Yeah.
And I think I have a question a little bit down the line about that. But so one of your acronyms, LCSW, I looked it up and I hope I have it right here, Licensed Clinical Social Worker. Mm-hmm. What's a licensed social clinical worker doing at a hospital? Is that something that this program obviously needs? Because I'm not that familiar with behavioral health services.
Yeah, no worries. Licensed clinical social workers, in addition, there's other licensed therapists that are in the field. That includes also licensed mental health counselors and licensed marriage and family therapists. Are generally masters trained and clinically supervised and then licensed by the state of Florida to provide therapeutic, psychiatric, and or mental health services. So we're credentialed in order to do psychotherapy, as well as also able to work in various treatment settings, evaluating, assessing, and developing treatment plans for individuals with depression, anxiety, or any other psychiatric condition.
I have to ask you, do all hospitals have behavioral health services? I feel like some do, and some are very specialized and some don't.
Yeah, some do. In Broward County, I'm aware of, I believe it's 10 or 12 facilities that are considered psychiatric receiving facilities. FMC happens to be one of the psychiatric receiving facilities in Broward County, which means that if there's a patient who is Baker Acted under the Florida statute, the Baker Act, the patients can be brought into a psychiatric receiving facility for further evaluation, diagnosis, and treatment.
Okay, that's good to know, and that's FMC right there off Oakland Park Boulevard. I will give the address there in a second. I didn't have it pulled up in front of me, but the other part of the acronym on the back end of your great resume here is CADC, and I'm a little more familiar with that. That's Certified Drug and Alcohol Counselor. So that's another service that FMC provides?
That's right now we are not officially a licensed detoxification unit. However, we do have counselors and psychiatrists that are trained in order to treat individuals who come in who may have an alcohol or drug abuse problem and have a co-occurring disorder, which would mean that they have depression, anxiety, or some other psychiatric condition, but also have a co-occurring substance abuse problem that needs addressing. We don't offer detoxification in the behavioral health unit because we're not licensed in that. However, detoxification can be offered in the medical part of the facility.
And that's people can obviously, if they're brought in, be evaluated there and diagnosed, and
Correct.
Then the start of the treatment, at least for that side of it.
That is correct.
Is done then.
Now, as far as my credential, it is a big advantage to be able to have the training in alcohol and drug abuse as well as generally referred to as sort of like a psychiatric social worker. I've worked psychiatry for 27 years since I got out of graduate school. Been working in settings like the VA Medical Center, child and adolescent psychiatric facilities, as well as now at a Florida Medical Center. And I've also worked in the arena of juvenile justice, where I provide psychiatric services and oversight of psychiatric services at the state level when I was in Georgia.
Wow. I mean, we're lucky to have you. And like I was saying before, why I wanted to rip through those acronyms is because I haven't seen that before. I mean, that is very prestigious, and we're lucky to have you. I mean, Miguel Fernandez, LCSW and CADC, just explained it to us, and Director of Behavioral Health Services at Florida Medical Center. And I do have the address ready, 5000 West Oakland Park Boulevard, Fort Lauderdale. For our listeners here in Boca, it's only a 30-minute drive from here with good traffic, maybe a little more if not. I mean,
right.
And the number there is 954-735-6000, where you can learn more about the programs. Website's floridamedcenter.com. That's the state Florida, Florida, med, medctr.com. Now, I wanted to ask you as well. I was kind of, we had just talked over email. We have been introduced by another PR manager who actually has done this program, Patty Villa. She's great. She actually does make it up here to do the program every once in a while. And I know she lives in Miami, so we always offer, but she is fantastic. Now, do you have a nursing background as a director of nursing too? Did I pick that up on your resume? Am I mistaken?
No, that's okay. And I am under my job description. I do have responsibilities over nursing staff at the hospital.
Oh, that's what it was.
As well as the program therapists that are in the hospital, and also the behavioral health aides. We call them behavioral health technicians that work at the hospital. However, throughout my career, particularly the last 15 years, I have been providing oversight of psychiatric and counseling and mental health medical services at Georgia Department of Juvenile Justice. So I've got a lot of experience working, administrating over nursing and also mental health and general counseling services.
I see. It's the direction,
yes,
not director.
That's correct.
See,
I do have a nursing manager that clinically provides oversight of the RNs that are working under my department.
Fantastic. I mean, it sounds like you guys have an amazing team. Now, one of the things that you also tackle, and we're seeing more and more of it actually every day. I mean, everyone who listens to the program knows, I'm a big music fan as well. And two of my favorite musicians this year took their lives because of depression. And that actually was Chester Bennington of Linkin Park and later Stone Temple Pilots, and then Chris Cornell of Soundgarden. I mean, so unexpected. Do you treat depression as well at the hospital level?
Yes, as a good amount of our admissions, I'd say roughly 25 to 30% of the admissions are secondary to individuals who come in either with depression and or with intent of self-harm or suicide. Those aren't always co-occurring. An individual can have depression, suffer from depression, but not really have an intent to harm themselves. However, oftentimes when we have individuals who come in under a Baker Act, it's because law enforcement may have been called out to their home and because they had been threatening to harm themselves, and they will quickly respond to the call and bring the patients in order to protect them and make sure that they're well cared for. So we do see a lot of depression over at the facility, and we treat a good amount of patients in the hospital on a regular, almost on a daily basis, that are suffering from depression. Patients oftentimes also come in voluntarily because they know they're just not feeling right, and will ask their family members to bring them to the hospital. And sometimes they don't even know that it's depression. They think it's something physiological or physical that's happening to them, and oftentimes we evaluate them and determine that it in fact is depression, and can treat that.
We're so lucky to have a great hospital in the area like Florida Medical Center that has programs like that to tackle depression. And, of course, thank law enforcement. They're out there every day, and they get into some interesting calls.
Yeah.
Is what the word.
Absolutely.
With Baker Act, I mean, good or bad, it's a great service that the police, law enforcement, emergency personnel, and the hospitals are providing as well. I'm going to take a quick break. On the other side, I'm going to ask Mr. Miguel Fernandez a little bit about psychiatric disorders a little bit more. I know you just did a lecture on it. You're actually on Twitter or Facebook. I found it today. We'll talk a little bit about electroconvulsive therapy as well on the You and Your Doctor show.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
Getting older is not for sissies. That's what one of my patients says. And it's funny, but it's true. Live long enough and you'll get arthritis, skin cancer, probably one of the common chronic diseases like CHF, COPD, diabetes. At All County Healthcare, we teach you how to manage your disease. We make sure you know how to take your medications and how to recognize signs and symptoms before requiring hospitalization, no matter how many visits it takes. You didn't move to Florida to be sick. You moved here to enjoy the rest of your life. And that's exactly what our team of nurses, therapists, and aides at All County Healthcare help you do.
You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Hello, South Florida, and we're back with Miguel Fernandez, LCSW, so that's licensed clinical social worker, and CADC, certified drug and alcohol counselor at Florida Medical Center in Fort Lauderdale. He's also director of behavioral health services. Miguel, right before the break, we were talking a little bit about depression. I know the hospital does a great job and able to take in bouts of depression and Baker Act as well. We talked a little bit about that. Are there emotional and psychological symptoms, maybe like family members or relatives, maybe if they notice something that points to depression, and maybe get the person to the hospital? Or
Absolutely. Well, some of the more common symptoms that we'll see in individuals that are suffering from depression may include decreased in appetite or an increase in appetite, a loss of motivation, and or a symptom called anhedonia, which is sort of a lack of drive or lack of desire to do things that normally they would have done if they weren't experiencing the symptoms of depression. In addition to that, sometimes increase or decrease sleep. In juveniles, sometimes you'll see agitation or irritability, but it can be also seen in adults. The other thing is the individual will have a difficulty with concentration and staying focused at work and being able to stay on task with their day-to-day activities. So those are some of the symptoms that we'll see. Sometimes, but not all of the time, you have symptoms of individuals having thoughts of feeling helpless and hopeless, at which point sometimes they may experience thoughts of harming themselves and or ending their lives. And those are the times where folks should be very concerned. Depression is very treatable. It's estimated that about 1 in 5 individuals has experienced a depressive episode at one point in their life. And there's a high number of individuals who are being treated for depression very successfully with something as simple as medications as a primary treatment measure. The common medications are called selective serotonin reuptake inhibitors, SSRIs, which are drugs like Prozac or Celexa, Paxil, and some of those other medications, and live very full and normal lives with the treatment of depression. The one thing that I also want to say is now during the holidays, I think it's important to be mindful that these holidays, and you probably have heard this several times, but that this could be a time of a lot of stress, a lot of deadlines, because December 25th comes very quickly, as well as some of the other holidays. And the streets are busy with people out shopping, and there's a lot of pressure and stress. In addition to that, a lot of stress about travel, as well as bringing family in, which sometimes brings up certain emotions or feelings that can trigger some symptoms of depression. So it's not uncommon for individuals during the holidays to feel melancholic. However, if it does get to the point where the symptoms are so overwhelming that the person can't function, then it definitely could be leading to depression and should be addressed clinically.
I totally agree with you about the traffic lately on the roads all of a sudden. Wow, on the way here, just. Yeah. And it just seems like everyone is in a very chaotic state all of a sudden as we get close to the big holiday, and after that, the even bigger holidays.
Yes.
Because we have different holidays.
That's exactly
South
right.
Florida. I mean, it's, yeah, and I have heard that before, and actually, I had a coworker once that, time of the year is tough, and his family wasn't here, so.
Right.
So that definitely, give the hospital a call, see if you can get your friend or family member in there if it comes to this point. Again, it's Florida Medical Center, 954-735-6000. I want to give out that number because I'm so happy that you joined us tonight. It's a very important time of the year. And you said another important thing about medications can easily help depression. I got into conversation with someone about this recently. So and correct me if I'm wrong, but the human brain creates enough serotonin for the day and then dumps that serotonin at the end of the day, kind of like dumps the file out.
That's correct.
Into the trash, and then produces new serotonin the next day. So those inhibitors that you were talking about, I believe, and correct me if I'm wrong, that they'll hold the serotonin in place
Correct.
long enough for the brain to feel good. And that's something that medication's not something you may not even have to be on your whole life.
Correct.
But it just gets you back into the state of normal quality of life.
That's exactly right.
Wow.
You said that just like a professor.
Hey, I'm learning something on this program. Over a year now talking health. So, yeah, that is awesome, that information that you're giving us today. One more thing about the kind of psychotic disorder is severe mania.
Mania. Mm-hmm.
Mania. So,
Yes.
like maniac, like mania. Okay. Or catatonia, something that you guys treat?
So one of the things you have certain disorders, for example, bipolar disorder, and there's 2 types of bipolar disorder, but one of the bipolar disorders, the predominant symptom is mania, which is extreme hyperactivity, difficulty sleeping, sometimes can include delusional thoughts, and or feelings of grandiosity, as well as other behaviors that are seen with mania. And in individuals with manic depressive disorder or bipolar disorder, that you will see the mania and depression. And so sometimes the individual cycles from episodes of depression and then mania and then sometimes back to depression. And so sometimes we'll see patients that come into the hospital with those symptoms. And then there's other disorders, including depression and also schizophrenia, where sometimes the symptoms of catatonia will come into play. And you'll see the individual severely anhedonic, which means basically a lack of desire energy to do anything, and almost become bedridden and/or in a position where they're completely disengaged physically and emotionally. And so when individuals fall into that catatonic state, sometimes there's treatment alternatives that can benefit them, one of them being, as we discussed, ECT.
Okay, and that goes right into ECT. We talked a little bit about it before, but it's electroconvulsive therapy. What exactly is that, and how does that work?
It is a treatment in psychiatry that has been done for many years. There's been an evolution in ECT where in the modern era of the use of ECT, it's used under moderate sedation anesthesia, similar to how you would have a procedure for a gastric procedure or some other type of procedure where the patient is almost in a sort of twilight state of sleep, and then the patient is immobilized in order for them not to have severe convulsions. And there are probes that are put in the temporal area of the head, and they cause a mild seizure that causes theoretically, it causes a change in the brain chemistry. Some theorize that it changes the chemistry itself, kind of like you described with the serotonin and whatnot. And then others theorize that it really increases the affinity of the neuroreceptors to accept medication for the treatment of psychiatric conditions. So they don't know exactly what the exact mechanism of effect is, but we do know that patients that have typically either not responded to medication type treatments or other treatments can benefit from the electroconvulsive therapy. And I've seen many cases over my career where people come in severely depressed, almost to the point where they're immobilized, and have walked out of the hospital in a very good mood and full of life and ready to take on the rest of the world. So it's really neat to see those individuals change so dramatically over a short period of time.
Yeah, and don't get it wrong if you're driving around or see this later on the YouTube or whatnot or Facebook Live, but this is the state-of-the-art technology that these hospitals have. You've seen the cardiologists we've had on with all their new tools, all the neurologists with Dr. Dalvey with the deep brain stimulator programming. But this is the top of the line, state-of-the-art medical equipment that you guys are using. So
Absolutely.
I just didn't want it to sound like, it wasn't. But electroconvulsive therapy is something that definitely can help. It definitely sounds like it can definitely help.
And if I can add, the other thing is that it's done in a very controlled environment. It's done inside a suite that we have in the hospital. There is an anesthesiologist, a medical doctor, as well as the psychiatrists that are actively involved in the treatment, as well as nurses, nurse anesthetists. And so it's a very controlled procedure. It's very safe for the patient. And so, there's been some negative publicity about the use of ECT years ago, but is a very safe procedure that can be very effective.
Wow, and it can help with quality of life.
Yes,
as Miguel
absolutely.
said. I wanted to ask you, I know the hospitals had just virtually every kind of renovation you could imagine. New cath lab I saw in South Florida Hospital News not too long ago, etc. New coat of paint on the outside. It looks like a different hospital. Tell us a little bit about your unit and how it's changed in just the last few months or year.
Absolutely. This is something that I am extremely excited about. When I first got to FMC, I came and I was hired with the understanding that we would be making some physical plant changes. As you had seen over the last couple of years at FMC, the exterior, it's a beautiful building that you see right off the turnpike. And like you said, the signs and everything really reflect the dramatic changes that we're going through at the hospital. On the behavioral health unit, the tenant corporate has provided capital expenditure dollars to be able to fully remodel the psychiatric units. So right now we have a budget to remodel both of the psychiatric units that are active, which it will include everything from new furniture and fixtures, that are in the arena of behavioral health or psychiatry are state of the art, using equipment that reduces ligature points, which for us, from a safety perspective, helps keep the patient safe while they're in their most vulnerable situation, as well as it is safer for the staff and the other patients because it reduces any other things that can be used to harm someone or yourself. And so we're really excited about that. We've got a fresh coat of paint, new bathrooms that are fully remodeled, and it's really exciting to see the change. The nurses' stations have been updated. Patient pantry has been updated. And so I'm really excited because we're just about to really take Florida Medical Center into the new era of state-of-the-art psychiatry.
I believe it too. I was there recently. It's the hallways. I describe it as spick and span, and I know I can't get to every point of the hospital like someone like yourself or employees that work there or should be in those areas. But man, that place just shines.
Yes. Yes.
Cool elevator wraps, everything, all the little touches like that. Yeah. I've went to a couple lectures there. I know you give a lot of lectures. I know you were just giving one on psychiatric disorders, but I've went to a South Florida Hospital News meeting. I think I mentioned that as well. I go to that group there, and great lecture room or presentation room that you have. And like I said before, you got a great CEO, and we're going to have him on the program soon. Very busy man, but sounds like the whole team is doing a great job. So again, I want to thank you for coming on the program, and Miguel, you're always welcome. And just tell the listeners, I just want to tell them, if you have a family member or friend with severe depression or any kind of psychiatric disorder, you think something's not right, get over to Florida Medical Center, give them a call at 954-735-6000. Take a look at their website really quick on the run, floridamedcenter.com. That's Florida, MEDCTR.com. And they're at 5000 West Oakland Park Boulevard in Fort Lauderdale. Like Miguel said, right at the Turnpike and Oakland Park Boulevard. Really easy to get in and out of. I've been there many times. A lot of doctors' offices right there on the campus as well. You have a lot of doctors on staff. I mean, pretty much everything is covered there. I know it's a big heart hospital. Orthopedic surgery is huge. Behavioral health, 74 beds. I mean, that's a huge behavioral health department. So thanks for coming on the program, and let us know when you ever have some new news, and we'll get you on for sure. Excellent. On the You and Your Doctor show as well. And thanks for coming aboard and sharing so much great info.
Excellent. Thank you for the opportunity. We appreciate it.
I appreciate it. And we'll be back with a family medicine physician on the You and Your Doctor show.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
Hi, I'm Deanna Barron, RN, with All County Healthcare. You know how I know that I've done a good job? We say goodbye. After you understand the medications you take, once you know that gaining 2 pounds in a day means you should call the doctor, when your wound is healed, when you can use your nebulizer all by yourself, when the goals that you and your all-county healthcare team of nurses, therapists, and aides established are met. We say goodbye. Very nice to meet you, and I hope I never see you again. And I mean that in the nicest way possible.
You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Welcome back, South Florida. The second half of the program, we got a really action-packed program. We have a family medicine physician, and we're going to continue the talk that we had on Friday with the endocrinologist on the program as we talked about diabetes and a little bit about thyroid, too. And then if you remember a couple weeks ago, we were talking about COPD, which I'm going to ask the doctor about as well. But without further ado, I want to welcome Dr. Mohammed Allahrakha.
Allahrakha, yes.
Allahrakha.
Yes,
Oh,
yes,
I
yes.
thought I had it right. I'm going to write that down phonetically.
You did good. You did good.
Allahrakha. Got it that time. And you are board certified. That's important nowadays. Not everyone's board certified, but you're board certified in, is it family medicine?
Family medicine, that is correct, yes.
Okay.
Yeah, so basically being a board certified family medicine, you are you have to take a test and you have to keep up with the credentials, basically go to seminars, take various courses to keep yourself up to date with the field of family medicine. Family medicine in general is a very diverse field because you almost have to know about everything. You're almost like a quarterback, and you're kind of waiting to pass the ball on to the wide receiver or whatnot, and so that's kind of what we almost have to know pretty much everything about everything.
Yeah, you study the whole body. I mean, that's amazing.
Exactly. Yes.
And you said that's a great way of kind of painting the picture as a quarterback of of health in a way. And I just want to bring to the listeners or the people who are going to watch on video now. It sounds like kind of a stupid question, but we know no question's stupid, right?
That's right.
So is family medicine, is that primary care then?
That is absolutely
Okay.
right. Yes. So we have three type of primary cares. We have a pediatrician, we have an internal medicine doctor, and then we have the family medicine doctor. The family medicine doctor kind of sees everything. He sees from cradle to grave, as to speak. And so, and the other thing we do is, in certain rural areas, we actually deliver babies. We
Wow,
also
I didn't
see
know that.
senior citizens. We deal with end-of-life situations. We deal with all their conditions from pretty much, from birth to their passing away.
Wow, I didn't know that. We learned something new.
That's right.
Every
That is
segment of
correct.
the
Yes,
show
yes,
tonight, as
yes.
well as before,
Yeah.
with another great expert from Florida Medical Center before. And you're on staff at Florida Medical Center, a great hospital. We were just talking about all the strides that they have made in just the last 5 years since I became aware of the hospital as well. Now, let me reverse it, though, back to your practice. Is what age group do you mostly take care of? I know you treat from cradle all the way through, but is there a specific age group like you treat a little bit more than?
Correct. So majority of my practice is involving 50 years and older, and a lot of geriatric patients. But yes, I do see patients from 2, and my oldest patient right now is 105 years old.
Oh,
Yes.
that's awesome to hear.
Yeah. So the way my practice works is I allow my patients to kind of walk in or do same day appointments. That way they're not having to wait 2 weeks to be seen for a cold or whatnot, which could be taken care of kind of on the same day.
Well, that's thank you for doing that.
Yeah, and we do procedures in my office. So if someone were to cut or have a laceration or whatnot, again, that's the field of medicine, family medicine that we are in.
Wow, that is good to know. And I actually found you on the hospital's website. They list you
Correct.
under the Find a Physician button as well. And I think I just brought it up here as we were talking. Yep, there it is. So you put in Dr. Allahrakha.
There you go. Yeah, very good. You got it.
his name in there, or you just search family practice or family medicine. I think it's listed as both. Family medicine, family practice, same thing,
Same
right?
thing. That is right.
And you're family medicine associates?
That is correct. That's
Okay.
That's my name under which I practice on.
Is that right there on the campus of the hospital, or just near it?
No, it's about a mile
Okay.
west of on Oakland Park, off of Inverary and Oakland Park.
Yeah, that's 7351 West Oakland Park Boulevard, Suite 103. It actually says Lauderhill, so it's just a little farther west, it seems like, than the hospital.
Correct.
Okay, I know
Correct.
exactly where it is.
Yes.
Just over the turnpike, I think.
Absolutely.
Okay. 954-716-6100 is the number. And, yeah, those same day or next day appointments, that sounds really good to listeners.
Yeah, we no, absolutely. And that's my whole motto, one day I had gone with my mother as a patient. She was a patient, and I realized that if I would like my mother to be treated and nicely and on time and so on. And so from that experience, I've learned I need to give the same courtesy to my patients as well, and that's kind of that's the motto I follow.
That's great to hear. It really is. And not to turn things on a spin all the way, but November is Diabetes Awareness Month.
Absolutely.
I really want to get into this with you because
Absolutely.
I know this is growing in the U.S.
Correct.
What exactly is diabetes? I always like to hear the doctor's response because...
So if we were to look at the book theory of what diabetes is basically a number. Okay. In the old days, a fasting sugar of 140 or more was considered diabetes, but we realized that even that is too high of a number. We have to bring that number down, the threshold down, as to speak. And so the latest number is 126. So if your fasting sugar is is more than 126, you're basically considered a diabetic or diabetes. Now, why is that so important? Well, there's about 11%, basically 1 in 10 people who have diabetes in the United States alone. And wherever blood goes, that's where diabetes goes, because that's where all the sugar goes. And it causes blockages in your arteries. It could also cause leakage in the arteries. And that's why people lose their eyes. That's why people lose their kidneys. That's why people lose their legs, because the nerves that are supposed to be receiving blood in their feet, they don't get it. So they start feeling numbness and tingling. So, the normal sugar should be less than 100. Anyone who's between 100 and 126, we kind of call them pre-diabetes. And so our aim is, again, trying to keep below 100 for someone who's never been diagnosed with diabetes. But someone who is borderline, which is pre-diabetes, the 100 to 126, we try to encourage the diet and the exercise to help bring it down, and hopefully they never get to it. Unfortunately, once a person is diagnosed with diabetes, they're kind of, it's going to stick with them. It's almost like, God forbid, if someone had cancer, once they've had a cancer, they're always going to be a cancer survivor, as to speak. Mm-hmm. So same thing with diabetic. When someone is diagnosed with diabetes, this is a diagnosis that's going to live with them.
Yeah, it's not reversible, but if monitored correctly, with a physician who's dedicated like yourself, or maybe your team as well, I'm sure you refer out to endocrinologists and whatnot.
Correct.
It's something that people can live with for a very long time,
Absolutely, absolutely.
Well, that's good news, at least, because it's not reversible, but
correct.
At least it's manageable.
Exactly.
Now, we talked recently on, I'm glad you said that it goes anywhere in the body where blood can go, because I've never heard that before. And you know what, that's so true, because we had a doctor of podiatric medicine on here, foot and ankle surgeon,
Sure.
And we talked about the diabetic foot for 15 minutes straight on here, because diabetes affects a lot of people's feet.
Absolutely.
And then if anything opens up there, it can be a pathway to infection.
Correct.
Or even disease.
Correct. So and I'm sure he spoke to you guys about it, is basically, because patients who have diabetes, they lose their sensation. They can't feel their feet. So they could be, I have patients that have, sometimes if their diabetes is so uncontrolled and they lost their sensation, they could be stepping on a nail and not even know it.
Yeah.
And that infection brews inside their foot, and it kind of grows until finally leaves a very open mark, and then we have to worry if it's going into the bones.
We're so timely here
Yes,
because
yes,
we had Dr. Mark Warren. He's the podiatrist that we had on. He was talking about how that he had a patient that had a paperclip in their foot for a long time and didn't know.
Correct.
Dr. Allahrakha, hold that thought.
Sure.
We're going to take a quick break. On the other side, I want to talk a little bit about insulin because we always hear that term. And if you
Sure.
don't have diabetes, you may not know what it is. And we're getting a little COPD and thyroid on the You and Your Doctor show.
Sure thing.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
Hi, my name is Deanna Barron. I'm an RN with All County Healthcare. I used to work for this huge corporate-owned home health agency, and I was always worried that they wouldn't let me make enough nursing visits to be sure that your wound was fully healed, or that you were completely comfortable checking your husband's blood sugar level and giving him the correct dose of insulin, or that your mom's lingering cough was the end of her bronchitis, not the beginning of a new episode. The owner of All County Healthcare always says, give the patient what they need, and he means it. At All County Healthcare, I see my patients until their goals are met, and I never worry. I hope you never need a nurse to come to your home, but if you do, tell your doctor, I want All County Healthcare.
You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
There it is. The light is Miami Hurricanes orange, so we're back on the air. No, this is FAU territory, but that's okay. But Dr. Allahrakha, I was so in tune with getting your last name right. I almost called you Dollar.
No. You're doing good. You're doing good with the name.
Yeah. So, doctor, let me ask you, right before the break, we were talking a lot about diabetes, and I want to ask you about insulin next, but I have to ask you this. Something I thought diabetes was something that only obese people got, but can skinny people have diabetes?
Absolutely. So diabetes can happen in anywhere from a very cachectic, thin person to a very obese person. However, yes, obese patients do have a tendency to have it more, which is the type 2 diabetes, and then you have the type 1, which they don't they're very rarely in the obese side, because this is something that they have grown with, meaning they genetically are not producing the insulin, which the
like
lack
congenital.
of insulin,
They're born with it, maybe.
They're born with it, exactly.
Whoa.
So those are the ones. Now, eventually, some patients, even though they may have type 2 diabetes, and they sometimes are thin, but their insulin production has gone down so much that, even though they're losing the weight and they're watching what they're eating, unfortunately the insulin is gone and they're now dependent on insulin. So those patients tend to be thin as well. But majority of the thin patients are type 1 diabetes.
Okay, and for someone who doesn't have diabetes, I always hear that term insulin and kind of know what it is, has something to do with blood sugar, but what is it? We have a doctor on the program. So
basically insulin is a hormone or a chemical, as to speak, that is produced from our organ called the pancreas. And there are certain cells called the beta cells. And the insulin is what kind of drives the sugar into our muscles, into our liver to be processed. So it's almost like the key, and you have all these locks that are in our muscles, in our liver, and so the key has to kind of fit to open the doors for the sugars to go in. So if the key is not being produced, or if it's the wrong type of key, then the locks are not going to get opened. And so that could happen because you were congenitally born with it, where you weren't able to make those keys or the insulin, or you kind of told your body, hey, I don't, if you're not eating properly, as to speak. And so the body kind of gets a negative feedback, says, oh, you know what, I'm not getting too much of use of myself, I'm not going to produce it anymore. And so it kind of downplays itself, and it stops making the insulin. And so that's kind of where the insulin comes in.
I see. I understand now. So that's something that insulin can be managed then with under the care of a physician.
Absolutely.
Okay.
So there's different types of insulins that we could give. But before we give the insulin, we try to obviously go with tablets. And even before the tablets, we try to go with the exercise and diet. Mainly the exercise and diet is basically kind of easing off on the carbohydrates, where that raises the sugar way too higher. And if the diet and the exercise are not working, then we go ahead and go with the tablets, and then the insulin, obviously.
Yeah, that noise is. I was just monitoring on Facebook. They're actually messaging me during the program. Never had that before.
Sure.
Of what to ask you next. That's really great.
Go ahead.
But yeah, now when does a primary care refer patients to an endocrinologist? So you manage it to a certain point, and then maybe use the team of an endocrinologist?
Absolutely. So basically what happens is, eventually when we're trying to do the exercise and diet, we're good, things are working out. When the patient or the patient's body is not, working with us, then we decide, we come to the tablets. There's various classes of medicines we could try. Once we've kind of exhausted those, now we're getting into insulin. Once we've tried to do certain insulin and we're like, okay, you know what, this patient is really is difficult because the body is just not cooperating, then we need the help of the endocrinologist. Now, the endocrinologist, yes, they deal with diabetes, but they tend to work more with insulin pumps, for example, where the body has completely shut down on producing the insulin. Then they help us out in managing the insulin pumps, as to speak, because the insulin pump is something that kind of is instilled inside your body, as to speak, and it releases the insulin according to the sugar that it's running in your sugar in your blood at that time.
Wow. We've had a great talk on diabetes this past week on this show, and if you have any questions, I'll give Dr. Allahrakha's number out again. He's over in Oakland Park Boulevard area of Fort Lauderdale. Actually, it's Lauderhill. It's just west of the Florida Medical Center, 954-716-6100. I don't want to shy too far away from diabetes, but November is also COPD Awareness Month.
Correct.
And this is something until a few years ago as well. I didn't know what it was. I just heard COPD. Then I saw the commercial. The patient said, it's like an elephant's on my chest. And then I kind of got it. That's this respiratory problem. Now, what is a COPD, and how does a family medicine physician fit in the treatment there?
Sure. So basically, again, COPD stands for chronic obstructive pulmonary disease. So that's the COPD. So as the word or the definition says, is chronic, meaning it's been there for a long time, or it can happen for a long time. Obstructive because it kind of blocks. It's very obstructing the passageways. And pulmonary because lung, that's like the scientific word for lungs. And then disease is the disease. And so basically what happens is because of chemical exposures, fume exposures, smoking, the biggest reason, what happens is through our bronchus, the tubes that take air into our lungs, they get blocked up. And thus air goes in, but it's not able to escape out. So just in a balloon, you're blowing a balloon, you're putting the air inside, and the balloon is expanding, but it's not able to deflate. And so when that happens, eventually the walls of this balloon or our lungs, they start to either collapse or they kind of expand so much that they pop out. And when they pop out, they're no longer able to, just like a balloon, like a small balloons. If you inflate them too much, they will eventually pop and they're no good as a balloon anymore. And that's kind of what happens with our lungs. And so, the biggest thing is obviously you want to get rid of the smoking or the fumes or the chemicals that initially started this process. They say that it can take up to 5 to 10 years for the person to avoid smoking, as to speak, in order for them to kind of become normal again. And so, the sooner you start, the better it is. Some people say, well, I'm going to wait 5-10 years, I might as well just continue smoking. Well, no, that's not necessarily true, because the day you stop smoking, within a month or two of that, your lungs start to clear up and your chances of your pneumonia keeps going down as the time goes by. So the faster you get rid of the chemical or the smoking, the better it is.
And I heard, like diabetes, once you have it, COPD is something that you'll have a little bit of for a very long time, if not the rest of your life, correct?
That is right, because just like I said, when these little balloons that are in your lungs, they're expanding, and eventually some of them are popped out, and they're no longer able to deflate and inflate. They kind of become scarred. And so some of that never comes back. But majority of it, where the blockages are, once the person stops smoking and uses the proper treatment, can hopefully help them where they don't progress to what we call severe COPD or even something called end-stage COPD.
Now, do you work to kind of use different treatments to break up that obstruction?
That is
percussive, I guess, would be the word.
So in the old days, what we used to do is we used to do percussions, where we would kind of tap on the person's back to kind of help stimulate the excretions to come out. Now there are various devices and various facilities we use, which helps to get the excretions out faster. You heard of these nebulizers that people use, and within those nebulizers, there are various modalities that one can use that will help open up the mucus and allow the mucus to come out. Just like as a little baby, when you're tapping on the baby's back to get out anything that's obstructed in their airway.
We only have one more minute. Quickly, I wanted to get to it, but thyroid, is that in the rise with baby boomers? You see a lot of baby boomers thyroid.
That is absolutely right. There's 15% of the population that have thyroid, and unfortunately, female are more than male. And the thyroid kind of gets into the diabetes as well, because it is one of those hormones that affects the metabolism of our body.
Wow, and people can see you for their thyroid as well. It's good to see your family practice.
Absolutely.
Dr. Mohammed Allahrakha, thank you so much for coming on the program. If you want to contact him, it's 954-716-6100. Thank you for listening to You and Your Doctor.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next